stocking up to fight back against Africa's biggest killer. A truckload of anti-malaria drugs is offloaded to immunize hundreds of thousands of children. In the rural community of Tangaza, a town crier mobilizes the community to bring the children forward. Abubakar Musa has been waiting for hours. He's already lost one child to the disease.
I stayed back to ensure that every child takes the drug because of its importance. After what happened to us, I don't want to take chances or see the loss of another child.
For the first time, donors including Unit Aid and Malaria Consortium are carrying out a large-scale operation to protect 7.5 million out of 25 million children under threat. The seasonal malaria chemoprevention, or SMC, targets the period between July and October, when infection rates are at their highest across the region.
Every 28 days, we repeat the dose for the next one. So within the first 28 days, the concentration is good enough to prevent malaria illness, while from 28 days, it starts to diminish.
Malaria accounts for 16% of maternal deaths and more than 40% of infant mortality rates in many countries of the Sahel. Statistics show that the disease costs the Nigerian economy more than $1 billion every year. Improved hygiene and sanitation can help, but donor agencies and government leaders hope that essential medicines such as these can also help reduce mortality rates.
Some governments are focusing on curative drugs and personal hygiene.
Sanitation alone will be able to cut down malaria by way of, the vector control by up to 50%. We also now introduced fumigation, which is larval control. Millions of doses of nets have been made available by the state government, and we're going to distribute them.
A shortage of funds means donors can reach less than a third of the children in the region, while a greater number remain exposed. Unless they too can access the drugs, many may not survive the onslaught of the killer disease. Ahmed Idris, Al Jazeera, Tangaza, Nigeria.